Stacey Ray, and I'm here to see Dr. Carroll and Dr. Carroll.
Alrighty. My name's Lisa. It's nice to meet you. And we'll just get started. You'll sign your name here.
Okay.
And if you have insurance cards, we'll take those and we'll get things started. Alright.
Thank you.
Hi, Stacey.
Hi, Linda.
How are you?
Good.
Good. I'm glad you came in.
I am here today to talk with you about Carroll Chiropractic and introduce some services that you provide here in Uptown Creston, Iowa, and would like to first ask you how long you have been in business here.
Well, we opened in May of 2009.
How many doctors are here in this office?
In this office, it is myself and my husband, Gabe. We're both chiropractors, so we can both adjust you. I also do acupuncture, and Gabe also does massage therapy.
Okay, and that is was my next question. That what kind of services do you provide, and what population specifically can you cater to?
Sure. Like I said, both Gabe and I can adjust. We have lots of different ways to adjust. We adjust babies, we adjust 100-year-old people, and everyone in between. We can do massage for, again, pretty much anyone, and acupuncture for also pretty much anyone.
Okay. What might bring a person into your business? What kind of ailments or difficulties might they be having that they could come see you for?
Sure. One of the most common things for chiropractic is neck pain, neck stiffness, shoulder tightness, headaches. Another really common one is low back pain, especially like the catch that you get right here in your low back when you're bending or when you're going from sitting to standing. Those are all things that we see every day for chiropractic and usually get results in a couple visits for that type of stuff.
Customers that come in and you can tell that they're a little bit nervous that it might be their first time in. Are there some misconceptions out there that we could talk about that might give that person watching the video feel them or help them feel a little bit more relaxed and maybe a little bit less intimidated by coming in here?
The main misconception, and I think that everyone is nervous about, is that it's going to hurt anything, whether it be adjusting or acupuncture or massage, and 99% of the time, no, it does not hurt at all. Like I said, we basically, for most people, come in and start right in this room, and we spend 15 or 20 minutes just talking to you and figuring out what's going on. And then at that point, we'll decide, which treatment would be best. Then we would go into, if we decided chiropractic, we'd go into that room, and I would fully explain everything that we're going to do, show you the table. It's not going to be any, all of a sudden I'm going to grab your neck. We're going to talk through everything. Same thing with acupuncture. We go in the room, I'll show you the needles, we'll put one in your leg so you can see it's no big deal and go from there.
Can you show me around?
I'd love to.
Thank you.
This is Gabe. He's our other chiropractor. And I'm going to show Stacey how I go about adjusting a low back.
All right.
Come up on
Step
this
up to the
table.
table. Can I push a button?
Absolutely. Gabe, I'm going to have you lean forward with your face in there and your hands go on the side. Stacey, you can push that orange button and make the table come down here.
Hold on to it.
Just one click. Perfect. Good job. This, we kind of feel around that joint and see which way it's not moving. I have a lot of chiropractic checks that I do, moving your legs, to see which way it's not working, and actually you can see Gabe's left leg goes back way further than his right leg, so that's an indication to me that his tailbone is out of place. So to fix that, we use the drop pieces. Now, this makes a loud thumping noise. It does not hurt.
Okay.
So the table comes up underneath you, and then I set the tension on it. And then basically, I put my hand on his tailbone and push straight down. Did that hurt, buddy?
Not at all.
No.
That did not hurt.
I can find where his neck would be out of place. And the table comes up underneath him. And again, I set the tension on it so it goes down. And then I'd find whatever bone was not moving right, and then just push straight down on it like that. we have an adjusting tool. This is called our activator. So I can do it on your hand if you want to see what it feels like. I use this on folks that might be a little nervous about having their neck popped. And I also do this in areas where I need a really specific adjustment. So I do this a lot up on the ribs. We can do it in the neck.
There's not a needle that comes out of there.
No,
it's
just
almost a pulse in a way, it seems
yeah,
like.
it's basically the same idea. Do you want to hold this?
Yes.
If I were to adjust Gabe's back, it's the same idea as me pushing down, but instead of having the broad contact of my hand to do a big area, it's a
More precise?
more precise.
Okay.
Exactly.
Okay. Are we making stone soup in here?
We are. It should be delicious. This is our massage room. It's set up right now for kind of a relaxing massage, but Gabe can do many different kinds. He can do deep tissue work. He can do specific rehab for an injury. Again, he'll come in and talk to you and decide what we need to do. If we needed to add massage, this is where you'd come. So everyone's questions are always, am I naked? You're fully covered all the time. You can leave whatever clothing on that you want. You can have lights on and do more of a rehab massage. You can dim the lights and do a relaxing one. Basically whatever the client's looking for.
Are those stones really hot or
They're
what is...
warm.
Okay.
He has them in the stone warmer. Right now Mike is just relaxing, but a lot of times I'm not a massage therapist, so he'll use them to actually rub on the tissue and warm it up.
Are there different levels of massage as far as, maybe you're walking in the mall and you see these people and they have their elbows jammed into your back and
Sure.
it does look very painful. Are there different levels? Say, I don't know that it looks like it would hurt.
Sure.
Can you come in here for something like that, or is it more geared towards the relaxation, kind of cleanse the mind?
Again, whatever you want. I prefer very light pressure. I prefer a relaxing experience. A lot of the bigger dudes will come in and say, jump on me, and
Okay.
luckily Gabe's big enough that he can jig his elbow in if you need to. So again, he's very flexible, as he always, when he's giving me a massage, he always says, let me know if I need to go lighter or harder. Don't be afraid to communicate what you want, and that way you can have a good experience.
You do have that option to choose between one specific area, or maybe only upper body, or maybe I'm
Absolutely.
having cramps in my leg and you can just work on that area, or you can do the entire...
Yep.
Okay.
Half an hour massages are good for like just shoulder tension, low back stuff, because you can just focus on that. Hours are good for, relaxing, or really if everything's hurting, then we can do that.
Okay. All right. Thank you. Well, I'm assuming this is the acupuncture room.
This is the acupuncture room.
I was confused. There's no bed of nails.
There's no bed of nails.
This looks not as intimidating as I had pictured.
No, it's not at all. So I was going to show you, let's say Lisa was having knee pain. I was going to show you just a typical needle insertion for that, and then you can kind of see what that's like.
Okay, I know nothing about acupuncture. I have laid on a bed of nails before. Not anywhere close to this?
Not anywhere close to that. Not anywhere close to getting a shot.
Okay,
So.
are you licensed to do piercings?
I'm not.
Tell me what acupuncture can do.
Absolutely. I typically do acupuncture for...
I'm really nervous.
It's okay. I typically do acupuncture for pain relief,
Okay.
knee pain, ankle pain, low back pain, neck pain. I do acupuncture for headaches, sinus pressure. I have a huge base of allergy patients that I see in the spring. I do acupuncture to manage the symptoms of anxiety and depression. Basically, there's a lot of uses for it. So we'd swab the area,
Okay.
and then the needles are very tiny. They're all individually wrapped and sterilized, and then you just pop one in.
Did that hurt?
Not at all. Nope.
So-
Every now and then you'll get one that zings just a little bit, but not at all.
Zings as in like a
Just like-
shock or lightning bolt or what?
No, just very light, just
Okay.
a little bit of a tap, and
Kind
then
of
it
a
just goes
tickle?
away. Yep. Oh. Okay.
If you want, we can do one on your hand so you can feel it.
It's okay.
It's
All right.
And this is typically how my acupuncture patients are when they first come in, And when someone's nervous, I just go ahead and put a needle in them right away so they can see that it's no big deal at all.
Okay.
So.
What,
That's
what
all
if
that felt like.
does it affect how you do this? If someone is super, super tense, do you have to try to get them relaxed before you can do anything? I mean,
No.
like if you're in getting readjusted, I'm sure it's harder to work on a patient when they're very tense and nervous. Not the situation here.
Not really, and typically once I put a needle in, the patient goes, oh, that's it, and then we just do the rest of it, so.
And it's not like giving blood. There's no blood that's coming out. You need to put a Band-Aid on or
No.
anything. Okay. So
So then this, I mean, I'd probably add a couple more, but
Okay.
this is basically what a knee pain acupuncture treatment would look like. We dim the lights, let Lisa relax for 15 or 20 minutes. I'd come back in and take them out, and that's all there is to it.
I definitely feel a lot more comfortable. You have that very good sense of relaxing somebody that comes in. Yeah. So what, maybe I'm still a little bit nervous, but do you have a website that I could go look at, or that I could tell my friends, hey, if you have any questions? Is it an interactive website?
Yep, www.carrollfamilychiropractic.com, or you can just Google Carroll Chiropractic in Creston and it'll come up. That takes you through some of our treatments that we do, some that we didn't talk about here. We have videos on that on the website as well.
Thank you very much.